Let's talk about fish oil, and the important ingredient there are the omega-3s. Some amazing statistics are that starting a fish oil supplement will lower your risk of dying from heart disease within 3 months.
Wow.
So any of you that started taking your fish oil on day one, right now you've already seen that benefit. And it does that by stabilizing the plaque. We've talked about plaque rupture and plaque breakdown. Well, fish oil helps to decrease that risk. It actually can help stabilize heart rhythm. People that have a condition called atrial fibrillation, higher doses of fish oil can actually prevent it from recurring. It lowers your blood pressure. It makes the blood a little bit thinner, and that's important. If you have surgery, you need to let your doctor know that you're on fish oil, because they need to stop it before the surgery so that you don't have any bleeding trouble. And we think there are other benefits. It's a very active area of research. If you saw something in the news recently about fish oil doesn't work, did anybody see that about 6 weeks ago? Big thing that came out. Well, the study looked at people that already had significantly advanced heart disease, only followed them for about 18 months. Not a great study. I mean, it basically said if you are really far down the road and in 18 months the fish oil doesn't change things. Not too big of a surprise on that. So we still feel that fish oil is a vital part of prevention. So where else can you get the fish oil? And I won't go through that list, but the lobster lovers, you know, 26 ounces of lobster a day will get you plenty of fish oil. English walnuts have that, and that's why walnuts are on our list of things in your diet. And then the different oils that are at the bottom. So Shannon may have talked to some of you about adding some flaxseed to your diet, using the linseed oil and olive oils. All of those have the omega-3s in them. So if you do like fish, those would be the ones to eat from time to time. The folks that benefit the most are people that have a very high triglyceride level, people that have the small garbage, because that's what penetrates the artery the most, people that already have plaque. We know that their arteries are likely to keep forming that plaque. People that don't eat much of any of those foods. I mean, there are a lot of people that just don't like fish. The American Heart Association recommends a couple of servings a week. We do have to be careful. I mentioned this about bleeding. So if you use it with aspirin, or if you're on another blood thinner, or if you're going to have surgery, you need to be sure your doctor knows about that. If you have any liver disease, because that's where our clotting factors are made, you have to be careful. We don't recommend it in pregnancy, or if you're planning on pregnancy. We just don't know what effect it could have. If you're allergic to fish, you can use the vegetarian form. You can even use the vegetarian form if you burp the fish oil. So fish get fish oil from algae. So by eating the algae, somebody's sticking your nose up at the algae thought. But you can go on this website that I've got.
So basically you can eat the algae, or you can take the fish oil.
There you go. There you go. Or you can buy an algae extract, and you won't burp the fish. So if you have problems with that. The active ingredient is the EPA, and you need between 1,000 and 2,000 milligrams a day. There is a prescription drug that's wonderful, but it is very expensive. And so Super Omega-3 is the one that I recommended to you. Comes 600 milligrams per tablet, and 2 or 3 tablets a day will help. The vegetarianvitamins.com website is where you can get the animal-free sources.